Hello everyone, my name is Grace Osuji. I'm a student at Brahman University. I'm here to present my video assignment on psychotherapy, in which I will cover 3 different psychotherapy treatments. So I'm going to talk about my patient background. This is a 50 years old African American female who presents with symptoms of depression. She stated that she had daily crying spell, felt sad all the time, had trouble sleeping. She reported that it takes her several hours to sleep. Sometimes she cannot sleep. She will be awake all night. She can only sleep 3 to 4 hours. All she does is stay awake, thinking and worrying. She acknowledged that some of her worries include thought that she was not a good mom, and she felt that she was a failure to her husband and her children. So she reported that she thought about her family of origin and her unsatisfactory relationship with her mother. She stated that she thought her depression has worsened after the birth of her 3rd child 10 months ago. During the initial intake interview, the client noted that she felt all right, always down. The all right response came out immediately, almost automatically after a pause. She added, "I'm always down." She revealed that she was constantly thinking and worrying, and she felt like everyone is looking at her as a failure mom, and she feel lonely. She denied suicidal behavior and addiction. She said it would be nice to run away from her problems, but she added that she knew she could not do that. She acknowledged that depression was affecting her life in a number of ways. For instance, she reported it was affecting her relationship with her husband and her children. So, based on a DMS-5, this client met criteria for major depression disorder. With the symptoms above, she had daily crying spell, she felt sad all the time, she had trouble sleeping at night, she was thinking and worrying and feel lonely. I'm going to use 3 methods to demonstrate how I will treat this my client. Number 1 method is CBT, which is a cognitive behavioral therapy. The second one will be interpersonal therapy, and the third one will be family counseling therapy. So, in the interpersonal and the cognitive behavioral therapy, what we think can shape how we feel. My client is depressed. For instance, my client's beliefs are not based on evidence, such as I'm a failure or everything goes wrong because of me. Changing this belief can change her views of event and her emotional state. So cognitive therapy look at current thinking and communication pattern rather than the past. As a therapist, I will work with my client to confront and challenge inappropriate thought by encouraging different ways of viewing a situation, and also it is a short-term goal oriented. So it will help my client pattern of thinking and behavior that is behind her difficulties. So the second pattern treatment I will use is interpersonal therapy. The main goal of interpersonal therapy is to improve the quality of a client's interpersonal relationship and the social functioning to help to reduce her stress. It is also a form of psychotherapy in which it focuses on a patient relationship with parents and family members and the way they see themselves. So I choose interpersonal therapy because it focuses on how my client's relationship and how it will practice it. So it also helps the client to learn and spot unhealthy behavior and change them. My client believes that she is a failure in the family, and I believe this will be a good therapy to help her to deal with family issues. So my third treatment therapy will be family counseling. So treating the entire family is good because it's not only the person with the diagnosis of depression. If a client is depressed, everyone in the family feels it too. And unfortunately, the family members may have the best of the intention without professional guidance. They sometimes make things worse. Family therapy is a good way for relatives to learn about depression and the early warning sign. So the client feel more comfortable talking openly with therapists there to guide the conversation. So I choose this because she acknowledged that depression was affecting her life in many ways. Especially, she reported that it has affected the relationship between her husband and her children. So I believe learning new ways of listening and how to ask and respond to questions openly rather than defensively will help my clients to cope with these issues of depression. So this is the three therapies I want to use on my client. So how do I encounter overall all this? So the way I expect the therapist to go is I want my client to be able to understand her feelings. I want her to make her feel positive, anxious, and depressed. This can equip her to cope with difficulties in a more adaptive way. And also, I want my clients to understand the source of her emotional distress, usually by exploring motives, need, and defense that she is not aware of. Now I'm going to talk about the cultural and the cultural differences and the background of my patient, how they believe they have on psych problem and the depression. My client is African American. In African American community, when you mention about depression or anything about mental problem, it sounds like a taboo to them. In many African community, it is a stigma and is a judgmental around depression. This stigma contributes to a reluctance to recognize the need for the help of physician or therapist. So African Americans believe to seek spiritual advice to help them with a mental health problem. When they believe they have problem, they prefer speaking to their family member living with them instead of consulting psychiatrists or psychologists. Many African Americans felt that my depression or anxiety will be considered that they are crazy in their social gathering. So they believe that talking to psychotherapists about their problem may be viewing as airing one's dirty laundry. So this is all I'm going to say about the psychotherapist. I'm going to welcome my clients for the first time in the session. Good day, Miss D. Good day.
Hi.
How are you?
Fine, thank you.
Before we begin our session today, do you consent to be audio to share with my school, Brahma University?
Yes.
Good. Were we were you able to complete the homework assignment?
Yes, I was able to complete the homework assignment. I actually used the homework assignment all of last week. I was having some difficulties in the morning starting my day, and I really felt bad on Tuesday when I woke up, and I was actually able to look. I realized the form was on my dresser. Thank God it was on my dresser. I was able to look at the form, and I just felt like I just didn't want to get up. I couldn't get going. I was just going to have a bad day. And when I looked at my form, I was also going through that the week before on a Wednesday. So I was able to use those words. Get up, start your day. Your day is going to go fine. Take it one step at a time. And you should complete, even if I didn't, like you told me last week, even if I don't complete all my things in one day, at least I complete some of the things in one day. So yes, the homework was very helpful.
Okay, great. Do you have any question about it, or is it helpful? Was it helpful to you?
Yes, very helpful.
Okay, so the homework assignment is part of a cognitive behavior therapy assignment. So where you change your negative thought to positive thought. For instance, when you have a thought like I can't, I will, I want you to say I will, I can. I want you to always have a positive thought. That's what the cognitive therapy is all about. So, can you give me example when you feel negative thought and how will you change it to positive thought?
Next week, when I wake up or even throughout the day, and I just feel kind of down, because sometimes that happens with me, I'll just, instead of saying I can, or I'm going to lay in this, I'm going to go back to bed, I'm going to lay down all day, I'm going to say, I'm going to get up and I'm going to keep going, and I will be successful today.
Great. So our next therapy is interpersonal therapy. So during this therapy session, I will focus on one issue, way to increase your communication with your family. So for instance, I want you to spend time at least once a week with your family. Can you tell me one how you can be able to communicate with your family?
I can initiate conversation maybe at the dinner table when we're having dinner as a family. I can think of things to say to my children when they're there and I'm at home alone with them. I can, instead of just letting them play, I guess I can go play with them, and then I can see, and that will help out. Yeah, I can do that. I can try that.
Great. Okay. Do you think you'll be comfortable doing that exercise?
Yeah, I can do it. Yeah.
Great. I'm looking forward to hear the result
Okay.
this week.
So you want me to sit? You want me to just start talking more to them?
Yes.
Do you want me to?
At least once a week, it will be at least once a week to sit down with the family and have a great communication.
Okay. Okay. I can do that.
Okay. So do you want some break? Do you want to take a little break, or do you want me to continue with the next therapy?
We can continue with the next therapy.
Okay. So the last therapy today will be about family therapy. So family therapy, it helps to improve communication and resolve family conflict. So in this session, I would like to involve members of your family, and then we're gonna complete a form. We're gonna do some exercise. That exercise is called genogram. So in the genogram, I'm gonna give you a form that all the family members will fill it up. I want everybody to write the relationship, like a picture, and then you write fill up the relationship that you have with each other.
Okay.
Yeah, so that's called family genogram.
Okay.
So I want you to take the form home and share it with your loved ones. So next session we will discuss about it.
Okay.
Okay. So do you have any question for me for that?
No. Just you want us to draw a picture of the family, and then talk about what each one of us do with each other.
Yes.
And okay, and then I bring it back in next week. Now, did you want me to bring my family too, or no?
No.
Okay.
Just a genogram.
Okay.
Okay. So I think this is we're gonna round up on the session for this week, and then next week I'll see you. So thank you for coming, and you have a nice day.
Thank you. Have a good day.
Okay. Bye.
Bye.
So in the nutshell, my client view her child as an emotional unsupportive, and unstable. So when she assumed the role of a parent, she resented, she acknowledged that she developed strong unresolved feeling of anger towards her mother, and this feeling continues to surface in her present relationship with her husband and her children. So with the three therapies, how do they relate to each other? I believe they have one thing in common: the cognitive therapy, the interpersonal therapy, and the family therapy. They have one thing in common: the potential effectiveness. They help the client to minimize and eliminate stressful environmental conditions. They help to reduce negative effect, improving interpersonal competency, resolving personal conflict, modifying people's inaccurate assumption about themselves, and fostering a more positive self. This is all I'm going to say for the therapy for today. I hope everybody enjoy the therapy. Thank you and have a nice day.